you in such a meeting. Before beginning, I would like to thank to everyone who contributed this organization. Now, it's very pleasure for me to introduce Professor Hakan Aboğlu for opening speech. Please, it's your turn. Thank you.
Thank you, Yeşim Hocam. First of all, I would like to thank the organizers, to you, Yeşim Hocam and Özden Hocam, for inviting me to deliver this speech today. It's my honor. I would like to welcome you all to this, I believe it's the first International Planetary Health and Family Medicine Congress. I believe this is a first in Turkey. I believe that this Congress is making a very good start with the participation of distinguished national and international speakers, and welcome you all. I'm the founder dean of this very new medical school at Izmir University of Economics. I used to work at 9 Eylül University, which is not far from here. As to the best of my knowledge, our medical school is the first in Turkey in which planetary health and lifestyle medicine has been added to the curriculum as a curricular theme and also as courses. We cover these two themes as a course in Human Society and Planet course. This is the name of the course. It goes on as a vertical course within the first 3 years of the medical curriculum, and then as an integration theme in the clinical years. Here we have this human part, and in the first years we cover as the humanities, and then comes the society part where we covered both public health and also community-oriented primary care. And then we have the planetary health, which is integrated into those concepts. And also within that, we have lifestyle medicine covered as a course in the second year of the curriculum. So in clinical years, we ask our students to link their patients' problems with the lifestyle choices and also with the planetary health issues as reflected on the well-being of the individuals and the society. Planetary health is also covered as an integration theme in other courses. I'm a professor of medical microbiology. For instance, in microbiology, we add the planetary health concept as the one health approach, where human health, animal health, and the ecosystem cells are not covered as separate items, but rather an integrated entity. Our medical curriculum is, I believe, planetary health as a concept is reflected in our curriculum in a good manner. Our aim is to raise awareness in our students and raise them as leaders of the future, because leadership will be required to transform the societies for a healthier planet, because our planet seems to be suffering a lot nowadays. I believe this Congress is a small but rather a very important step to raise awareness in this planetary health concept, and I want to think it as a call for action. I want to thank everybody for being a part of this, contributing to this, and I wish you all a very productive Congress. In the meantime, I should add this. Now, as I'm going to take over the rectorship of this university, I will bring planetary health as a concept to whole university, as well as the lifestyle medicine as part of the well-being. So we are very open. It's a call to our colleagues, both national and international. We want to collaborate on these two topics as much as we can, because it is not only the students working on the health field, but rather on all fields. We require people who are, aware of the problems and issues with the planet and their lifestyle choices. So it's an open invitation to you all to collaborate in the future. So with that, I would like to thank you, and I'm very honored to be part of this. Thanks for inviting here, and I wish you a very good Congress. Bye-bye. And I'm asking your permission to leave because the schedule is so busy. Thank you very much.
Thank you.
I'm sorry. Thank you very much being here and opening the Congress. And can we move on to speakers? Okay. Yes. Today's topic is a very important and very interesting topic. We have a very I want to tell about the pandemic that we realize that our planet is a whole unit and we cannot think one another without with another. I'm sorry, I'm a little excited. So now at the beginning, I want to introduce you Dr. Maria Pilar Astiar Pena, and she will talk about the Global Action Plan, World Health Organization. And please, Dr. Pilar.
Thank you very much. Thank you for the invitation to participate in the 14th conference of the Turkish Family Physician Association, and thank you for the extraordinary team you made to conduct this idea, and especially thanks to Ozdin Gogmir for inviting me personally. I'm going to share my screen, and I will ask you if you are able to show it properly. Okay, thank you very much for your feedback. I will move this. Great. So I'm Pilar Astier. I'm a family doctor. I'm the chair of the Patient Safety Spanish Society for Family and Community Medicine in Patient Safety Working Party and the Spanish Society for Healthcare Quality. And as well, I work in the WONCA Executive Board as a member at large and belongs to the Quality and Safety Working Party of WONCA. And through WONCA, I have the opportunity to join the international technical team of more than 300 people who contributes to design and prepare the Global Patient Safety 2021-2030 plan. And I would like to thank all them for the contribution, and is the whole planet here. We were connected in different time schedules, and we did extraordinary work to provide all health care systems with a plan, with a way to address patient safety as a planet, as a worldwide objective. And what's patient safety? Therefore, patient safety is how we organize the healthcare, how professionals, organizations are managing risk to reduce the possibility of harming while providing care in a proactive way, in a preventive way, and reactive once things happen, and plan it and mitigate, give support the patients, families, and the professional involved in some adverse events that are not preventable. And how this started, sorry, I'm trying to pass out here. Well, in 1999, The publication of the report Towards Human of the Institute of Medicine gave us an evidence that harm was linked to the healthcare we provide. And at that time, it was the 8th cause of death in the United States. Nevertheless, in 2015, it went up to the 3rd cause, means the complexity of the healthcare provision increases the danger and the possibility, the likelihood of harming patients. So we need to drive professionals to build a way to provide a safer care, managing risk with a systemic approach, with a no blame culture, and speaking up about our own mistakes in the primary healthcare facilities, analyze, improve, and particularly learn. That is really the most important. And what is the global burden of unsafe care in healthcare? Regarding data of the OECD, in hospitals, 1 in every 10 patients are harmed because of the health care they receive. And in primary and ambulatory care, 4 out of 10 patients are harmed because of the health care we provide. And it's not only the harm, but as well the cost. The cost of opportunity means if we invest a 15% of the total hospital expenditure trying to recover patients that had been harmed, is a loss of opportunities. And this can rise up 83% of harm to patients in the healthcare that is avoidable. And as well is an ethical and deontological issue too. And here that we are in a university setting and we are grooming our leaders in the future of healthcare professionals, is this ethical and deontological issue is really important. The World Health Organization said in 2009 the definition of safe healthcare, the prevention of errors and adverse effects to patients associated with the healthcare we provide. And it start as policy implemented and impulsed by the World Health Organization and governments. Therefore, healthcare organizations structure patient safety programs. And finally, we, healthcare professionals, implement safe practices to have a better result on the health of the population. But we are really, we are concerned about the patient safety, and we realize that all the health professionals made similar mistakes, and these mistakes are harming people. So the World Health Organization prepared some challenges, some common challenges, and it was hand hygiene in 2005, and next Friday, the 5th of May, we'll celebrate the World Hand Hygiene Patient Days. And for surgical area, the surgical safety checklist and the safe childbirth checklist in 2015. And finally, in 2017, medication without harm that involves mainly primary healthcare facilities in the safe use of medications. For primary care, the World Health Organization developed some technical series on safer primary care regarding the use of electronic tools, the electronic medical records, concerning multimorbidity of our patients, how to train and educate the new health professionals, patient engagement, human factors, transition of care, medication errors, diagnostic errors, and administrative errors as the main problems that we have at unsafe healthcare. So how to address in primary care facilities these topics. And they provide as well some tools as the patient safety incident reporting and learning system that helps us to communicate our incidents, to analyze and learn. And finally, the proposal to include patient safety in the curriculum guide of multi-professionals. But nevertheless, all these challenges, they need that the 193 countries that bring out the World Health Assembly reach an agreement on patient safety as a global health priority. They establish an annual World Patient Safety Day on the 17th of September and urge member states to introduce patient safety in the policy priorities. And in 2021, we were able to launch the Global Patient Safety Action Plan 2021-2030. This plan has 7 guiding principles: engage patients and families, make this plan in a collaborative way, generate learning, actionable and measurable improvements, and quite close to the nature of care setting, in our case, primary care, and use scientific expertise and patient experience to improve patient safety. Finally, these areas will build up a safety culture, and we are all involved in launching and developing this plan. Governments, healthcare facilities and services, stakeholders as WONCA, and the whole secretariat who is conducting the follow-up of the implementation of the plan. The vision we all share is a world in which no one would be harmed in the healthcare and every patient receive safe and respectful care every time, everywhere, in every family medicine practice, in every primary health care center. And we all together will sustain this mission in our different roles, the role as family medicines, in primary care, in our healthcare facilities, or through scientific societies, as WONCA is doing to promote the patient safety action plan. This plan is organized in 7 strategic objectives. They can be seen as quite far from our clinical practice, but they help. These 7 strategic objectives will help that our care facilities will be more safe and that the health professionals working there will be more prepared to make a nice risk management to provide a safer healthcare. These strategic objectives involves policies, involves high reliability systems, a safety clinical process, patients and family engagement, health workers involvement in education, skills and safety, and how we deal with information to make a proper risk management for patients. And finally, we are not doing those strategic objectives alone, but we belong to a worldwide network of partnerships and solidarity to develop this plan. We built a plan in 7 strategic objectives, but particularly with 5 operative, more close to the practice objectives. We are going to show the perspective of the role of primary healthcare and family medicine in this plan. The first one is policies to eliminate avoidable harm in healthcare. Make zero avoidable harm to patients a state of mind of our own practices. So regarding primary healthcare, to set in our practices a patient safety policy priority, quality is essential to give safe care, but the patient safety is the basic dimension of the quality in which we harming patient. Therefore, we need investment in primary healthcare, and we need that governments were involved to make some legislation changes to promote reporting and learning systems to health professionals be able to analyze and learn. WONCA is collaborating on regulating some primary healthcare practice accreditation to guarantee certain indicators, certain standards that help health professionals to provide safer healthcare. And finally, to observe the World Patient Safety Day together. The second is to build up high reliability systems. That means that we are thinking in a system analysis approach, never individual approach, always we're working in teams, and we are preparing some barriers to avoid the risk causing harms, means to improve our training, to help the rest of the team to implement safe practices, and to promote the involvement of patients in their safe healthcare. So patient safety first, and family medicine should be the leadership in patient safety in primary healthcare. We have a word and we have an example to show up. Safety network is the team. So if we introduce this culture of opening, talking about mistakes and the way we are addressing them, because we are human and we are fallible, then the team will work together and we can create a safety network. So the role of the primary healthcare as well in the community will help people to be involved in the safety of their health as well. We do not forget that we have to design and we have to promote clinical processes in a safe way. That means in primary healthcare, there are some situations that we are exposed to a higher risk. So we have to try to plan those situations in a better way, as emergency care in primary healthcare, for example, having the health information system who help us to address patient needs in an emergency situation, a safe use of medication, because medication is the most used technology in primary healthcare facilities. Then to introduce good practices in what we are doing as hand hygiene, prudent use of antibiotics, vaccination strategies from primary care, safe coordination of transitions of care. We are conducting patients along their journey in the health system, and we are a reference for them for a safety care as well. Patient and family engagement is essential because patients and citizens are involved in primary health care. We should listen and learning from their experience in the whole system, means to analyze the journey of the patient along the system, and they are always coming back to primary healthcare, and we can collect their experiences and the opportunities they have already found for a safer healthcare. Recognizing and promoting patient advocacy for patient safety, and to get skills to open disclosure when things are not being as planned, and we need to explain to the patient, explain to the family, give an alternative plan, and support them in recovering from adverse events or patient safety incidents. Therefore, to promote health literacy, just to collaborate and be a safe network with them as well. We were thinking as well on health workers, education, skills, and safety to contribute to the design and delivery of safe care systems, developing the World Health Organization patient safety curriculum. We are now in the SME University. The SME University is a new medical school, and we invite them, as they have already introduced planetary health as in the curriculum, to join this opportunity to include the patient safety full curriculum as well, because it will help to have healthcare professional awareness on patient safety. Then to train and simulate situations in primary healthcare that are unsafe, and we can address them in a safer way. Then promoting patient safety professionals reaccreditation, just raising awareness of the importance of implementing safe practice everywhere, every time. Incentive for meeting these patient safety goals in primary care, and physical and emotional well-being support as well for primary care professionals. Information, research, and risk management are the tools we are using to guarantee a safer healthcare. So, to promote the reporting of these patient safety incidents in these reporting and learning systems, build up patient safety groups to analyze these mistakes, these failures, and to address the implementation of quality improvement, to collect patient safety data, just to have the picture. And there are some sine qua non patient safety indicators, things that should not happen in any time, in any way. So we have to prevent them from happening. Therefore, improving research in patient safety in primary care and using the technology, the digital technology, as a barrier to avoid error and as patient safety facilitator in facilities. The last objective, synergy, partnerships, and solidarity is essential. WONCA is one of the stakeholders that engage the patient safety global action plan. We, as family doctors, are a patient safety agent in primary healthcare, and we have to work on improving the healthcare in our facilities. And as well, we have a very wide network of collaborations through Wonkin Party on Quality and Safety. I invite you to join us and to work together to improve the safe of the healthcare we provide in primary care. And as well, a multi-sectorial initiatives through TICs, through WONCA regions, the World Health Organization regions as well, and other organizations that are promoting patient safety as a right, as a human right to provide a safe healthcare to all everywhere. And this commitment will be implemented and assessed at the same time. This assessment is made in a great diversity of structures and funding and governments. There are a wide variety of healthcare systems worldwide, no single policy or strategy that universally can apply to all of types. So there are some key milestones. Every country should assess its landscape, have a leadership commitment, being sustainable in implementation, and align the plan, the patient safety plan, with the national context, because some contexts will need some legislation changes, some improvement in health information systems, and other designing a model of change, a model of cultural change. It takes time, but if we are committed, we will able to attain it. And what is really important is that this plan will be assessed every 2 years in the World Health Assembly. That means that this year, 2023, in May World Health Assembly, it will be an evaluation of some indicators. And some of the indicators that are challenging are here. the number of countries that have developed a national action plan or equivalent to implement patient safety policies and strategies, to have the possibility to access a reporting learning system in healthcare organizations, to guarantee a reduction in healthcare-associated infections, a reduction in medication-related harm, and a number of countries that have incorporated patient safety curriculum in education programs or courses for healthcare professionals. So I invite you to do so. And finally, linking to sustainability, to planetary health, primary care is related with the universal health coverage, but as well with the patient safety action plan. This plan is strictly connected with the Sustainable Development Goal 1, no poverty, good health and well-being for all, gender equality, clean water and sanitation, decent work and economic growth, reduce inequalities, and responsible consumption and production means world sustainability, planet health as well. So some reflections for discussion. What does the global plan of action on patient safety bring to family medicine, bring to medical students? What opportunities for improvement can we implement? What actions should be promoted at the political, legislative, regulatory level to foster a culture of patient safety in our countries? And what role do we have in our workplace? Everyone to provide a safer care. And now we have to walk the talk to improve patient safety. So thank you very much.
Thank you, Dr. Maria. This was an interesting and nice talk, and I realized that we have much, we need to do much things, especially in Turkey. We have good plans, but recently we realized that we are not good at in taking action. So we need a lot of to do. Now, also, it was surprising to hear that more patients are harmed in primary care than in hospitals.
It's primary care and ambulatory care, and the severity is not so intense, or in the magnitude of the severity is different hospitals and primary care. But because we visit a lot of patients per week, perhaps in my situation, for example, if I visit 40 to 50 patients per day, in a week, I can visit 250 patients. So the possibility to have different patient safety incidents is higher because the patients come more times to the primary healthcare facilities than to the hospitals. And at the hospitals, the severity is higher, but the frequency of the visits are higher in primary healthcare.
You're right. Okay, maybe there is some questions or contributions. I want to ask the other people if there is any question or contribution. I think no. Meanwhile, I want to ask you a question. Which is your personal opinion? Which is the priority of in these topics? What do you think? Where do we begin?
Well, regarding primary healthcare and the role of family doctor, this is really essential. And there are different topics, but one area in which we can do a lot is in a safe use of medication, because we are coordinating the whole medication plan for patients, even though some of the medication are prescribed from specialized care or hospital care, but we collect all the plan of the medications plans of patients, and we can avoid side effects, interactions, and low value practices there. And another is to listen to patients, because when patients come to our consultation, they tell us about their journey, and they highlight in which situations they feel unsafe. So we can listen and collect this information to improve even the whole organization of the health system. That is really important, because we are a coordinator of healthcare provision. We are sending them to hospital consultations or as inpatients, and they have some experiences that are they have the trust on us, and they are able to communicate this experience to us as well. So we can address many options and then share with different facilities to improve.
Okay, thank you, Dr. Pillar. Also, you asked us nice questions. They are very important to debate on it. Maybe at the end of the session, we can have time and talk again. Thank you again, and I want to introduce the second speaker, Dr. Christian Lokotola.
Thank you very much.
Thank you very much. He's also lecturer in planetary health and working on climate change, migration, and health development education, and connecting with the School of Climate. He also recently published an interesting review about climate change and primary health care in Africa. Yes, Dr. Lokotola, we are pleased to hear you.
I am not sure if he's here or not, because we couldn't see. There is a doctor. I am not sure who is the doctor. I have asked in the chat, but no answer has came. If so, and if it is possible for Andre, could we just move with Andre? Andre.
Yes, we can.
Thank you very much. You are a lifesaver.
Oh, I don't know about that, but thank you.
Very welcome. Okay, then we will talk about the green practice and quality of health. Dr. Andre is president of the European Society of Quality and Safety in Family Medicine, and also director of Quality Improvement and Doctors' Health Program in Irish College of General Practitioners. Thank you very much to join us, and we are listening to you now. Thank you.
Oh, thank you very much. And thank you so much for inviting me to join you today. This is one of my favorite topics, and a very current topic. And it's a hot topic right all over the world now, really, isn't it? And so I'd like to share some of my thoughts on greener practices, quality of healthcare, and of course that comes under the umbrella of planetary health. And please excuse my voice, because we live in the countryside and there's rapeseed in the field behind us, and it's a very late spring and all the pollen has come together, so I'm afraid my nose is blocked. So, okay, so when we're talking about greener practices and then quality and then planetary health, I'm just going to reverse the order of the topic and maybe begin with planetary health. And Pilar has already mentioned the Sustainable Development Goals, so I won't go into any detail on that. And then I'd just like to bring the focus down towards quality of care and patient care, and then ask what can we do to make our practices more green. So on planetary health, there are many definitions, and many definitions of sustainability and planetary health and One Health, but I've got three reliable sources here for definitions of these three. I'm not going to read them all through for you, but essentially planetary health focuses on the health of humans and the systems that human life and civilization exists in. One Health is a more unifying approach that emphasizes the importance of flora and fauna. And sustainability, of course, has many different approaches and definitions, and sits not just in healthcare, but in engineering and science and economics and so on. But I've taken my definition from the UN website. And we're well aware of all of these wonderful goals. And I draw your attention to number 3, good health and well-being, to number 13, climate action. And there are 169 targets and many, many publications on these SDGs. And we need to be mindful of them. It's the bigger picture of healthcare. And just a few weeks ago, in March, the quadripartite agreement came together to, I suppose, in a way it emphasizes the cross disciplines that we need to be working in, and that sustainability, planetary health and One Health isn't just the remit of healthcare professionals, but this is involving food and agriculture, animal health, and so on. But it also involves other sectors. It involves education, public health, and many other sectors. So this is really something that healthcare, more than ever, we need to collaborate with other sectors in society. And there's a lot of aims and priorities on that WHO website about this One Health agreement. I'd encourage you to access it. And all of this is happening for the co-benefit of us, the healthcare professionals, our practice teams, patients and families, all people, well, healthy, ill, and of course, the planet and the ecosystems on the planet. So we're thinking big here, because it's impossible for an unhealthy planet to support healthy people. And when we look at quality of care, we're going to do a very quick tour of quality of care. I'd like you to think of quality care in the context of needing to address healthier lifestyles when we're thinking of planetary health. And to begin with that, let's look at where health sits in the dimensions of quality of life. And we have the European Union report here on the 9 dimensions of quality of life. And we can see that health is just one of the 9 dimensions of quality of life. We have governance and basic rights, natural and living environment, leisure and social interactions. We know how important that is for our patients' well-being as well. And income, material living conditions, and work as a main activity, something productive, something for self-worth and self-identity. And of course, health and education. So there are many dimensions of quality of life. And this report states that it is very difficult to measure quality of life for our patients and indeed for ourselves as citizens. But it's definitely worth going beyond GDP figures. So this again brings in this multidimensional approach to get a more comprehensive view of what is quality of life. What are we aiming for to improve for our patients? And that brings us on to the 6 dimensions of quality of care, so nicely outlined by Don Berwick. And last year, Zalika and I, 2 members of EQUIP, which is the European Society for Quality and Safety in Family Medicine, which is part of Wonka Europe. It's an active network in Wonka Europe, and I'll come back to that in a moment. But we decided to put a little bit of a challenge out into medical literature and propose a 7th domain for quality in primary care. Now, interestingly, after we had put together this paper, I was even having second thoughts about where sustainability should sit in quality of care and where it should sit in the European definition of general practice. So it's worth exploring that in your own mind first, and we'll come back on it. And there's a lot of exploring going on about where sustainability actually sits. Is it a domain of quality of care? Is it an umbrella over quality of care? Is it the foundation of quality of care? And there's no right or wrong answer for any of those options. So these are just some key points from the article piece. So a more sustainable healthcare service can improve patient outcomes and improve capacity for healthcare workers to engage in quality improvement and thereby complete a circle of quality of care. And if it's high quality, it has cognizance of efficiency, which when we bite down on that, it's efficient use of available resources. And if we're using available resources efficiently, we can actually decrease healthcare costs, increase the value of healthcare, and lead to better health outcomes overall. And we have an important role as primary care workers on the front line. And then on the other side, the healthcare sector is a significant carbon emitter. So we need to be mindful of the consumption of the health sector's resources. And if we exclude prescribing, which is the greatest source of carbon footprint in primary healthcare, the next source is transport by patients and staff to healthcare sites. Now that includes referring patients onto other services. And then, of course, all of the consumables and non-consumables and energy. Okay, so we can't go forward on talking about greener practices or sustainability without bringing in quaternary prevention and over-medicalization and over-diagnosis. And in 2018, the Wonka Europe position paper on over-diagnosis was launched, and this was a collaborative piece of work between several of the Wonka Europe networks. The following year, Carlos Martins and John Broderson and colleagues in Europrev published a wonderful paper in the British Journal of General Practice on the evidence base behind quaternary prevention. And then in the Wonka World Book of Family Medicine, we brought them together again in terms of the networks of within Wonka Europe. So some exploration there, some calls to action, and we're here now in 2023. Oh, let's go forward here. There we go. And many of us, our daily work is, the majority of our daily work and our appointments are for chronic disease management. And for focusing on quality of care, we really need to focus on chronic disease management and the contributions of lifestyle factors. So we really need to develop our skills to work with people on the topic of lifestyle behavior change, because although medications are necessary and needed, we can continue to add new medications and increase doses, or we can look at combining the medication management, medical management with lifestyle management. If we look at something like the European guidelines on cardiovascular disease prevention, all of the guidelines internationally on, for example, hypertension, they open with number 1, address lifestyle factors. Yet how much time do we devote in our consultations to addressing lifestyle factors before we do all of the other medical interventions? Really important that we expand and explore that part of the consultation for One Health and Planetary Health. And lifestyle medicine, again, many definitions exist, but it's a branch of medicine. It's a science based on science and based on evidence. And it can help to prevent, treat, and even reverse chronic diseases across all the life stages. And there are many activities involved in lifestyle medicine, and many of the pillars of lifestyle medicine here, such as nutrition, sleep, stress management, social aspects to quality of life, sexual health, physical activity, while we minimize risky behaviors and environmental exposures. These are all the remit of lifestyle medicine. And we know that there's a lifestyle medicine special interest group just launched during the COVID pandemic, actually, within Wonka Europe. And this year, in June, we're meeting within the Wonka Europe Council to discuss the revision of the European definition of family medicine, which will take into account these issues: sustainable healthcare, planetary health, and One Health. So I'm not able to expand on that further at the moment because it needs to be discussed and agreed at the Wonka Council in Brussels in June. But suffice to say that it is a major revision of the European definition, and more on that to come. So I would encourage all of you who are listening to encourage your national council member within Wonka Europe to support the inclusion of this revision in its final format into the European definition of family medicine and general practice. And then just to close, greener practices. What can we do? Well, in terms of global warming, there is a global warning to healthcare. And if we were a country, we would be the 5th largest emitter on the planet. That's very significant. And we can see here from the UK a wonderful bar chart showing primary care pharmaceuticals, including GP prescriptions, right up there at the top. So that's the low-hanging fruit that we can address. Some of us are already doing this really, really well in various countries across the globe on deep prescribing. And this small project in the southeast of Ireland where I practice, involving one of our trainees, 2 of our trainees actually, 3 of our trainees actually, because Kieran is with us as well. So anyway, 3 of our trainees were involved in this at various times when they worked in different practices. And they looked to see what they could deprescribe with safety in mind, patient safety in mind, and what they could deprescribe in nursing homes. And they discovered that with the reductions that they made in just a few small months from 5 GP practices, if that was extrapolated all over the Republic of Ireland, we would save 30 million euros a year. So deprescribing is one, but you can see in this infographic on the right-hand side here, and this is the infographic that the Sustainability Working Group, now renamed Sustainability and Planetary Health Working Group in the Irish College, has brought out to describe how GPs can be involved in promoting planetary health and in carrying out actions. And those actions could be on the top left diagram there: leadership, role modeling, advocacy, what we can do for prescribing and patient care, what we can do in terms of lifestyle advice and nutrition, and what we can do in terms of prescribing. And in terms of prescribing, but also in terms of referrals or arranging investigations and tests, we have wonderful initiatives worldwide, from Wiser Healthcare to Choosing Wisely. And our signature is so powerful for every one of these movements. Who is monitoring our requests and prescriptions? Should we do an X-ray or an MRI or none? Or why should we repeat this lipid test for this patient? The Wonka World Environment Working Party have a planetary health education course in several modules. And they had a lovely paper in the Lancet in February, just a few months ago, describing this particular course. We need to work with patients and people to give them signposts to information. For example, on antibiotic stewardship and rational prescribing of antibiotics, to protect and to respect our health services, and to avoid this growing concept in terms of on-demand tests and treatment where, patients expect MRIs and sometimes several MRIs at the same time. And we need to explain the rational progress of investigations and how that's important for their safety and avoid iatrogenic conditions. And we need to ask ourselves, if somebody is looking for a lipid test, did the previous lipid test change the patient's behavior and lifestyle? And will this one? And what else is needed for this patient apart from a blood test? I know that Terry is going to be speaking in a few moments about toolkits. So I just wanted to show one page on this GP toolkit, which was launched on Earth Day just last week, a soft launch, and we're launching it fully at the EQUIP conference in Dublin in May, on the 12th and 3rd of May. And essentially this toolkit is a menu that GPs and GP trainees can choose an action that they might want to initiate and innovate on in their practice and spread the word, because we are all called to action, and it's an urgent call to action as primary care workers and as citizens. We've learned a lot of lessons from COVID about the interconnectedness of how we live our lives and how the health sector and all the various aspects of the health sector are interconnected in terms of consumption of health sector resources and the Earth's finite resources. Earth Day 2023 was about investing in our planet. For environmental protection, we really need to look at how we invest in our planet and how the healthcare workforce can help people to invest in our planet. On the 12th and 13th of May, we have a spotlight on quality of care in family medicine. And during that, we will have a symposium on planetary health, One Health and Sustainability, and we launch our Irish green toolkit, which we call GLOS toolkit, because GLOS is green in the Irish language. And I'd like to encourage you to get involved in EQUIP. This is our website, and we've launched our new website just last night, qualityfamilymedicine.eu. And if you click on the logo for the conference, you will actually be able to get into the conference website as well. But we're just one of the networks within Wonka Europe, which covers a wide area, 47 member organizations in Europe. So if we all do something in terms of greener practices to improve lifestyles, address chronic disease management in our practices in this wide area, every little initiative and innovation will count, because the biosphere doesn't belong to us, we belong to it. And thank you for your attention.
Thank you very much, Dr. Andre. Thank you for this wonderful speech, and also the last sentence was the very important message for everyone. If there is any question or contribution, first of all, I want to ask the other audience. And okay, pandemic has been a process where we all question our life, and I think there was another important point where governments and people realize the importance of primary care in health. What do you think, Dr. Andrea? Was this important point of the pandemic? Maybe the good point, only good point?
Where primary care, the value of primary care was more recognizable?
Yeah.
Oh, I think so. I actually don't think there have been enough reports reporting on that very, very topic, actually. I know there are many publications on the role of primary care, but it's piecemeal, and we need some large organizations and national colleges to come out with statements and to work with policymakers going forward, because that's where we need to go with this information. I think that National Health Services did recognise the value of primary care during COVID, but memories are short because other priorities take over and they have other priorities to address. So it's up to us now, because we were at the table with policymakers during the COVID pandemic, and we need to make sure that we sit there with a strong footing. And so we need to have a louder voice.
Yeah, and also I can talk about Turkey. It was important for people to realize that it's not necessary to go to hospital for everything. So it was another point. Okay. Dr. Özden, what do you think? We are a little ahead of the schedule.
Yes, we are going early.
Yeah.
And but Christian Lume is here. If he is ready to go on, we can go on. If not, we can just have a break. Where are you, Christian?
Maybe
Hey, I'm fine. I'm there. Thanks.
Great. Would you like to go on? If not, we can have a
No.
break.
It's okay. I can go on.
All right, let's do it.
welcome, Dr. Christian.
Okay, I'm just trying to load my presentation. Can you see my screen?
Yes, we can.
Maybe I have to put it on.
But it is not just the slideshow. Yes, we can see it.
Okay. Yeah, I think yes, that will. To us here, it's almost afternoon, so we can just say good afternoon or good morning. I don't know if we are at the same time, but I just want to talk a bit of what we think about planetary health and family medicine here in Stellenbosch University. So since the issue of global warming and climate change became one of the threat for human health, health in general, it's quite clear that climate change as one of the ecological driver, putting all the ecological driver together, we just come to a huge impact on health, and the family physicians, family doctors, in particular, doctors in general, will really feel the impact of climate change, as climate change, the impact of the ecological drivers, global pollution, resource scarcity, biodiversity loss, land use cover change. So all of them are different ecological drivers of, that makes the change in the ecosystem of the planet. Our planet is quite sick, mixing them with different proximate causes and different mediating factors, such as the culture, the behavior of people, and also the governance. So it just comes to huge health effects that will lead to increase of malnutrition, infectious disease, and mental health, and you name it. So climate change being declared as a huge problem to our health, it's just bring this vulnerability to it just increasing the burden of disease to many people, and most of the vulnerable people, such as children, the pregnant women, because of age, poor people, will really feel the impact of climate change. And as I said, all these people may reach to you as practitioners, and you have to respond to the questions, you have to respond to their issue. considering not only the fact that they present to you, the disease that they present to you, but also understanding what is beyond the symptoms that you're presenting. So the issue of the impact of climate change, we can consider three aspects of that. Climate change is increasing the burden of disease, but at the same time, climate change is affecting the healthcare services, and this really need resilience of the services. But at the same time, the health service itself is contributing to the problem. And so we really need to make it family physicians should contribute to the solution, but not only being part of the problem as they're working in different health facilities. So the increase of the burden of disease, so that's one of the impact of climate change. Human displacement. Climate change will reach to many of displacement of people, migration, and these people will come to your hospitals where you are not maybe ready to receive these people. The issue of language, for example, this is one of the experience here in South Africa. People are coming because of climate change, climate migrant. They come, they don't know, they can't speak English, but they're sick, and you have to receive them in the hospital. You have to give health, because you are called to universal covered of healthcare. So you have to do it. So now, how can you deal with this kind of people? So you need to get ready to face the issue of climate change. At the same time, you may be there that it's not possible to work because the hospital, the health facility is being flooded. So these are the impact of climate change, and we are contributing as family physicians. We're working in the hospitals, we're contributing in the problem. So we need really to become aware. So with the framework of planetary health, it's just give to the physicians an opportunity to improve health by understanding what is going on as environmental drivers of different cases, the increase of morbidity and mortality. So that comes to being prepared. That's yourself, you need to get educated, understand the issue of the link between climate change and health, understand what is climate change, but at the same time, understand how you can protect your patient. The previous speaker spoke very well about your relationship between you with the patient during the consultancy room. So it's important that you understand how to improve individual health literacy and understand how you can contribute to promote good health in the community by doing, for example, risk assessment of climate change impact in that community. You're trying to make them more responsible of understanding how they can improve their health themselves in in their community. So your community oriented practice will really help them to understand how they can improve their situation during this the increase of the effect of climate change. This comes to the effect of your impact in clinical governance and leadership. So it's quite important that the doctor, you become aware of the preparedness. This comes to three pillars. I like to call it three pillars. You need to create a resilient health services and a resilient community against climate change. At the same time, climate resilient health services, climate resilient community, and also provide health without harm. So I'm turning there. We just conduct a scoping review where we come up by applying the World Health Organization building blocks to build a primary healthcare, climate resilient primary healthcare. So we come out with understanding the impact that the role that a family physician can do in terms of leadership, in terms of finances, in terms of service delivery. So in terms of health information system, with our scoping review, we found that they were quite difficult to see that the health workforces, don't have much knowledge on climate change and the clinical governance. It's not easy for them to pick up the effect. It's just starting now. So the health organization building blocks is helping us to transform the health the health services, our health services, to try to become more resilient. So this is understanding the consequences of climate change and its relationship with health inequity, giving some evidence and management process to reduce the expenditures, the waste, issue of waste, issue of carbon footprint, how you can contribute to that. In one of the charts, I'll show some of the actions that we think can be important that you can do. So being more active in reducing the impact of climate change should be part of your work, because if we were a country, as the previous speaker said, we are almost the fifth producer of global emission. We contribute a lot by 4.4%. This is quite huge. So these are through our procurement services, through our pharmaceutical services, energy that we're consuming, the building, the transport, the food that we produce in the hospital. So all of this are really releasing excess quantity of pollution, and this contributes to the problem. So we need to build the ground by here in with what we're doing. We're trying to prepare the family physicians by inserting in the different courses, leadership governments. We try to embed planetary health and teach them what they can do, like to reduce the impact of clinical, healthcare emission footprint. So by considering the effect, their impact on leadership, biodiversity, energy, water, waste. So we're dealing with these cases, teaching them some of the actions and bring them into the discussion, so they really come up with some ideas, become more innovative to the in terms of solving the issue. So this is one of my, okay. So these are some of the actions that we tried into the discussion with the family physicians. We try to bring them to this. In terms of leadership, what are some examples that you can bring to solve the issue of climate change in your facility? Evaluate, for example, your carbon footprint, promote behavior change, try to dedicate staff resources to address environmental health issues at your facility. So in terms of chemicals, adopt, for example, policies and ensure that the chemicals undergo basic toxic test. We try to replace as soon as possible products that are at high risk. We try to tell them what they can do in terms of reducing waste, to avoid some disposal of medication. In the issue of water, the issue of transport, these are different actions for the transport. For example, adopted transport means that reduce hospital carbon footprint and reduce hospital environmental footprint while fostering healthy food. In terms of building, what are the new plans that we can do to try to decrease the carbon footprint? So I think that was some of the actions that we were trying to do through a workshop with the family physicians as part of their teachings. I think, thank you.
Thank you, Dr. Christian. Yeah, we have lots of problems and we have lots of to do. Migration is also a very important issue in our country. We generally heavily exposed and we deal with it so much. Could you tell us something about the main burden of migration on health system? Your voice is
You're muted, Christian.
Oh, sorry. Okay. So what was the question? Sorry, I had a problem with the connection here.
Okay, no problem. Migration is a big problem in your country and also in our country, an important issue. Can you tell a few sentences about the burden of migration on the health system and, of course, for primary care?
Yeah. For the health system, yes. South Africa is one of the countries receiving many migrants from different countries of Africa. These migrants can be from climate migrants, from social, economical conditions, flowing here in South Africa. So these patients, the migrants end up by coming with some of health conditions and they have to be received in the hospital. The experience that we are having, one of the problem is the language. Most of the doctors are trained in English, and you can get a patient coming and speak French, and you need to get a translator. And at the same time, you need to make sure that the translator is really saying exactly the problem and returning to the patient what you really want to say. So the translation problem. So this is the experience that we are having in terms of language. But another issue is that it's just making the primary health care being more crowded than we couldn't imagine. So we're receiving many people in the hospital while the facility was made for a certain number of the people. So overcrowded patients, making the situation a bit difficult in terms of dealing with all the migrants. So these are some of the issue that we're facing with the issue of migration and the primary health care. But we're trying now to solve all these problems and try to receive all the patients. So there are different translators who understand the system, making sure that we can have, if you have a problem with like a French patient, a French doctor who is working here, if you get a chance in the system, can be connected to you during your consultation. You connect him, so it lets you help in the translation and understand what the patient is saying, returning to the patient to what you really want the patient to understand. So these are some of the strategies. We have many of them, but this is our experience in South Africa.
Very nice. And also telemedicine may be a good solution for some of these problems. Is there any questions or contribution to Dr. Christian? I'm looking at the chat box.
Well, Andrea said that it was a great presentation, and thank you very much for this. And also, Gobit says that this was great too for Andrea and also for Christian. My question is, we have got lots of migrant patients too, or individuals. So not only in South Africa, but countries who are get refugees or migrants has got the same problem, and sometimes they are just coming like a flow, not like the river or not like one by one. There is a word in Turkish, it says that if you are coming for something, let's do it one by one, but most of the time the things are just coming all together, not as could be managed or as could be idealized. So thank you very much. We have seen that not only it was our problem, it is a worldwide problem because of our planet is ill. And in a diseased house, how can you have got healthy people? So,
thank you so much. So it's not only your problem, it's also our problem. I think you can get it to all over. As long as there are migrants all over the world, this issue can really we can different health facilities or different health system will feel it. So we need to get ready.
But when we cry, the tears are the same. It has got nothing to change with it. And also when we laugh, it is the same. And maybe if we could just try to get in the basics like this, we can handle it down. And There are
Exactly.
lots of things to say, so but thank you very much. And also Maria Pilar, thank you very much too, with Andre and Christian. Now my question is, Liz and Terry, would you like to go on or take a break? Where are you?
It's Terry here. I'm happy to keep going.
All right then. So what would you like to say, our Professor Yeşimuncu?
I think this time this is Liz's turn. Maybe we can move on her speech, or we can ask to other people who would like to have a break or not. Should we make a poll?
Well, if we just stop screen sharing, I think Christian, we are seeing the Christian window. If we can close it. Are you here, Christian? Again, we lost you. No, we aren't. If you can stop sharing, we can just listen to Liz.
Yeah.
Thank you. We got it.
Okay. Dr. Liz, very welcome. Hi. Could
Hi.
you? Oh, okay. Now.
Let's see if this works. Can you see this screen okay?
Yeah.
Yes.
So thank you so much for having me. My name is Liz Willits, and I'm the inaugural policy director at the Planetary Health Alliance. I am about 1 month into this role and very excited for the role as well as the opportunity to speak here today. I'm going to switch over to my slideshow. And in discussion with Ozden, we decided that this talk would focus on global policy, and that is an area where I have a significant amount of experience and where Planetary Health Alliance really wants to increase its focus over the next year. I was really interested in Andrea's comments about taking action and how some of the knowledge and evidence can be mobilized into policy spaces. So I hope we can touch base on the areas of interest of the attendees here. And if not, please let me know and we can open the dialogue. We've heard about planetary health. I wanted to just share Planetary Health Alliance's view that we're talking about environmental degradation and the human disruptions, the human activity that's leading to that degradation across natural systems and its impacts on the health of humans and on all of life on Earth. What we're focusing on at the Planetary Health Alliance is not just the local, not just the global, not just communicable disease, but the whole spectrum of health that includes communicable disease, non-communicable disease, mental health, and health emergencies. And we're looking at that across domains. So we're looking beyond climate change. We're looking beyond antimicrobial resistance. We're looking at what some people know as the planetary boundaries. There are 9 planetary boundaries that are at risk or very tiptoeing over the line of transgression in terms of our land use and our ocean acidification, the ozone in our atmosphere, the impacts on freshwater cycling, the use of chemicals and nutrient runoff, and a host of other environmental harms that are happening and that are having impacts on our local, our municipal, our national, our regional, and our global health. This is a more scientific slide looking at those drivers. So the second column, if you will, is looking at the intersection of global environmental changes and environmental degradation, because these harms to the environment are not happening in silos. They're happening at the same time, and they're having compound effects and interrelated effects. Our patterns of sustainable consumption and production are leading to these harms, and in turn, that is causing a range of other issues, including health outcomes on humans, such as new patterns of infectious disease, non-communicable disease, nutritional disease, mental health, and also a range of problems in specific organ systems, including the reproductive system. And as we know, although there's a significantly less research, the same harms that are happening to human species are happening to the fish in our water bodies, to the birds, to any other species that has a similarity in their physiology and exposure to these harms. So I'll get to the meat of what I was to be talking about today, which is the policymaking in the government space. This graphic is one snapshot for if we were to look today in 2023 at our global decision-making spaces for these environmental harms. They are housed under different, different houses of the UN system. So each of these blocks, we have a climate change block, we have a health block, we have food systems, and then lumped in together, we have biodiversity and chemicals. Each of those are managed by a different branch of the UN. They have different treaties, different multilateral environmental agreements. And in that sense, they are being managed and governed in silos. But in terms of planetary health, what we're really looking at is this systems approach and the idea of integrated policy. Not only because the substance is integrated, such as, for example, the rates of biodiversity loss are related to our use of chemicals, but they're also integrated because decisions made in one forum will affect the other. Increasingly, we're seeing interconnection between decision-making and references in the climate change and biodiversity arenas, and much more could be done to increase integration. Excuse me, I have a bit of a scratch in my throat today. For this talk, there's tremendous amounts being done in climate and health. Across the other planetary boundaries, a bit less. The focus of the rest of my slides here are on biodiversity and health, and a primary reason for that is some upcoming very key decision-making forums that will be taking place in Turkey in 2024. So here is a slide that demonstrates the interlinkages of biodiversity and human health. This tree is full of little circles that demonstrate categories of those interlinkages. This is a graphic produced by the World Health Organization and the Convention on Biological Diversity, essentially the home for the governance of biodiversity and ecosystems. These interlinkages are broad and numerous. Here you can see the big categories of mental health, pharmaceuticals, traditional medicine, infectious disease, microbial diversity, air and water quality, food systems and nutrition, and disaster risk, as well as climate change. So the Convention on Biological Diversity, as I mentioned, is one of the major decision-making forums under the UN on biodiversity. There are 5 other conventions on aspects of biodiversity, but the CBD is almost a mother home for this work and interrelates to all of the others. There was a landmark meeting at the end of December 22. This was the the 15th meeting of the UN Biodiversity Conference, and it took place in Montreal. It had been delayed a couple of years due to the COVID-19 pandemic. And what came out of this meeting, one of the key outcomes is a new global biodiversity framework. The last decision to have a global framework for managing biodiversity was in 2010. So this is a milestone that is going to intends to mobilize new interest, new policies, uptake, investments, and a general consideration for biodiversity, ecosystems, and nature across the world. 196 countries were part of this agreement. And we have a really open space looking forward to think about how the health sector and health stakeholders participate in this space. A key element in this roadmap is the next meeting of the UN Biodiversity Conference, the 16th meeting. It will take place in late 2024, and it will be in Turkey. Now, there are quite a few elements that are contained in the Global Biodiversity Framework. I'll get to those in my next slide that could be of interest to health stakeholders, as well as other decisions. So the Global Biodiversity Framework was just one decision. There are other decisions that could be of real relevance to health stakeholders. But a key one is the plans to adopt a global action plan on biodiversity and human health. And that is expected in the meeting in Turkey in 2024. So the planning and the roadmap to get there started as soon as COP16 was decided. So as I was mentioning, there are a range of issues that will be at this meeting. They include some integrated policy. So there is a decision under the Convention on Biological Diversity on climate change. There's a focus on biocultural diversity and so this could tie in, for example, to the diversity of patient bases, to marginalized communities and health equity. There are decisions on food systems and soil biodiversity and how we grow our food, the regulation of air and water and climate and disaster risk, urban blue and green spaces. And then there's the role of synthetic biology, plastics, pesticides, hazardous chemicals. And then in terms of communicable disease, there's an effort to reduce spillovers. So how changes in land use affect zoonoses. In general, a number of these items are increasingly of interest to the health sector, and this could be a key moment in 2024 to take a next step and advance more robust policy. The Planetary Health Alliance goal is looking ahead specifically at the UN Biodiversity Conference in COP16 and in Turkey is to start to build a health stakeholder network to advocate for stronger policies in these areas. We're looking to mobilize collaborations and specifically with national associations of medicine. At COP15 in December 2022, I was contributed to mobilizing half a dozen stakeholder organizations, including the Canadian Association of Physicians for the Environment, to be accredited to the UNCBD and to attend that meeting. It was extremely valuable, and they have built a significant momentum coming out of that meeting to continue to be stakeholders in this policy space. We are looking in our policy work to generate new capacity to translate evidence and science and diverse knowledge into policymaking spaces, and then to attend and participate this meeting, among others, with really informed engagement, with the overall goal of strengthening biodiversity governance and decision makings for the health and well-being of humans and all of life on Earth. This is particularly relevant since the history of stakeholder participation in biodiversity conferences is very low. Up until about a year ago, there was, even on the general records, maybe one health stakeholder participating amongst thousands of environmental stakeholders. There is real opportunity here to have a strong impact and to demonstrate, for example, the awareness and value to family medicine physicians of the policymaking process and the role of biodiversity in our health and well-being. So just quickly, we'll talk about the Planetary Health Alliance itself. This is a group that spans over 21,000 individual members across over 65 countries. We have 360 institutional members, and we have, in the last couple of years, been developing 10 regional hubs with regional hub leads who help participate in all of our activities. I will be doing a strong capacity building exercise with the regional hub leads for the policy work that we're planning on doing in biodiversity, as well as all other domains. And one of our key outputs so far as an organization is the Planetary Health Education Framework. This is a tool that can be used to incorporate planetary health ideas into higher education or any other education system or across any discipline. One of the ways this has been taken forward just happened recently in Canada when the Association of Faculties of Medicine of Canada mobilized an academic health institution declaration on planetary health. This is something that is open for signature worldwide and currently has all 15 medical schools in the country of Canada have signed on to this declaration, which is forward-looking in terms of incorporating planetary health into medical curriculums, into healthcare and public health, and to taking a more proactive position in policy decision-making, including on climate change and health, and creating more resilient healthcare systems in the face of these planetary boundaries, which are creating a number of risks. So in short summary, there are a number of ways for anyone interested to engage with the Planetary Health Alliance. That includes simply being a member or being part of our subscriber newsletter. We have opportunities to strengthen the regional hub. There are also the tools of the Planetary Health Education Framework that can be taken forward. The Academic Health Institution Declaration can be signed on and built into national institution planning. There's also, in terms of the biodiversity meeting and the upcoming work in 2024, anyone interested worldwide, but specifically in Turkey, who wants to attend and have an impact in the space can request accreditation to the CBD and then plan to register and participate in that meeting when it comes up in any of its preparatory sessions. One other aspect of the Planetary Health Alliance that may be of interest, we have an annual meeting. This convenes experts in the field. It also has a focus on evidence, on education, best practices, and this coming year will have a focus on policy. The next meeting will be in Malaysia in April 2024, and it will be hosted by the Sunway Center in Planetary Health. We greatly welcome any new members or any interested parties to attend this meeting as well. It is shaping up to be a really, really interesting event. So thank you so much.
Thank you. Thank you very much, Liz. I was just trying to become a member of the Planetary Health Alliance. You share a QR code, and I was trying to be.
Yes, I can put it back up if you like.
Okay.
Here.
No, I just put. Thank you very much for the great presentation and speech. There was something which interested me very much. I want to ask something about it. You mentioned the interdisciplinary education. Can you tell us something about that? What kind of curriculum or who are the stakeholders?
Sure. Sorry, I'm scratching my throat. So, sure. So there was a bullet on the slide under biodiversity issues, key issues, that I listed the interdisciplinary education. I think that's a really interesting one. And it's a bit overshadowed. The Convention on Biological Diversity, so 196 countries have adopted various decisions, including this global biodiversity framework. And one element that they emphasize is the need for diverse stakeholders to increase their investment in interdisciplinary education. So there is a formal government decision under this treaty that says this is something we need to focus on. And that means so if we translate that to the health sector, how can the health sector build biodiversity considerations into curriculums so that there is kind of a movement to reshape how we train any dimension of student? So specifically for the health sector, it would be public health and medical students. Some of this work is being done in climate change. So climate change is entering curriculums worldwide. It's something that's gotten a lot of awareness building. The other dimensions of the environment are a bit behind. But it is something that was called for. It can be responded to. Governments are going to need help doing that. It's a new field and territory. And the interdisciplinary part relates to not just bringing different disciplines together, so bringing ecologists in with medical professionals, for example. It also relates to the type of education. When we say education, we often mean formal. Go to school and you do a curriculum. But the CBD actually recognizes informal education, so intergenerational learning, such as a practice that's very highly valued in Indigenous communities is the learning about space, nature, and environment between, for example, grandparents and new children. And then there's the non-formal education, so recreational clubs and other elements of communities that don't focus on formal education, might be camps or clubs and things like this that can also take up this idea of interdisciplinary education. There's some really good work being done on that and a big focus on that by the Global Youth Biodiversity Network, which can be a nice space to collaborate. It's a group of 1 million youth under age of 35, and they have a big focus on reforming education to be more appropriate and considerate of biodiversity.
Thank you very much. Really interesting. And we have to think a lot on it. If there is questions or contributions, it's time for it.
Just want to ask if you're still able to extend the number of the hubs in different regions, because I can see for Africa we have the West and the East, but I noticed in the Southern Africa we have different activities on planetary health. Master Family Lecture of Planetary Health. In the medical, the new curriculum, we're trying to embed planetary health for the undergraduates. I'm teaching it already with the postgraduates, mostly family physicians in preparation. So we quite doing something, so quite a lot. So maybe I'm trying to want to help to come on our side, maybe.
No, that's great, Christian, and we should touch base. Maybe we can exchange our emails. We are reinvesting in the development of our hubs. So you're right. So we have kind of North Africa, Middle East. We're following the UN Statistics Division of hubs. So we have North Africa, Middle East, and then we have Sub-Saharan Africa, but the only divisions we have right now are East and West. I'm talking to someone for potentially a Central African hub, but yes, we welcome new interest and leadership if we want to expand that, including the development of another sub-regional hub. And in terms of Turkey, we have membership leads from Azerbaijan, and Kyrgyzstan would really welcome a leader from Turkey to come on board for that work, and happy to follow up with anyone afterwards.
Thank you, Christian, and thank you, Liz. Is there any contribution? I think Christian wrote his mail address in the chat box. You can find it there. Okay, if not, we can move on. Dr. Terry's speech. He will share their experience in UK with for Green Toolkit and other net zero carbon initiatives. Welcome, Terry, Dr. Terry. Nice to be you here. Yes, thank you very much. We are listening you.
Okay, so I've prepared a video which runs for 24 minutes, and then I was going to do some question and answers if needed after that. Osden, can you do the video?
Well, I asked Olcan to make it. I think he shared on the link, and we will just go on right now if we can make it. Just a minute, please.
Okay.
Hello, everybody. Can I get the co-host so I can share my screen?
You are.
Not at the moment, I guess.
And so you are.
Okay, awesome. So I do believe that everyone can see my screen.
Hi.
Yes, we can.
I'm going to talk to you about the UK's experience with the Green Toolkit and other net zero carbon initiatives. This is a pre-recorded video, but there will be a live question and answer session at the end, so please post any questions, comments, etc. in the chat if that's available. I'm a retired family doctor from Bristol in England. I've had various roles in green issues in primary care. I have no conflicts of interest. I am not a climate change expert, but I am from the generation that made it all worse. Sorry about that. What the climate change experts is saying is we all need to do more and do it faster. Because carbon dioxide is going up in our atmosphere, and that will cause climate change. There are other greenhouse gases, notably methane, nitrous oxide, and the F gases, which are propellants in things like metered-dose inhalers and asthma. And those F gases can be typically 2,000 to 3,000 times more greenhouse gas warmers than carbon dioxide. The way we're going, we know that we're likely to reach almost 3 degrees C by the end of this century, rather than stay below 1.5. So countries will experience many or all of the problems of flooding, heat stress, water stress, wildfires, hurricanes, sea level rise, and unpredictably mass migrations. Turkey is likely to experience extremes of heat with less rainfall, possibly an increase in global sea level, and of course lower income countries will suffer most. The per capita CO2 emissions in Turkey are about the same as the United Kingdom. United Kingdom has come down a lot. Turkey appears to be flattening out. And Turkey's net zero target is for 2053 at the moment. But we're going to talk mostly about healthcare today. And healthcare in countries like the UK and probably Turkey accounts for about 5% of the country's carbon footprints or carbon emissions. And that breaks down across the health service to about 20% of it usually comes from primary care. And in primary care, it's arrow 1 on the right, you can see that arrow 2, medicines and chemicals, makes the bulk of our carbon footprint. Arrow 3, and a large part of that is just from metered-dose inhalers in the UK. And arrow 4 is the transport of patients and staff backwards and forwards. So why don't we do more? Here are some commonly given reasons why people don't do more. So I'm going to talk about those a little bit more in a moment. We surveyed family physician trainees and educators in England last year, and in my part of the world, the southwest of England, we found that 70% had no planetary health learning or training, 80% felt they had insufficient learning and training, more than 50% were not aware of the 3 main resources that were freely available to them, and 25% were not aware of any of the GP resources that were available to them, which includes the toolkits. So, Let's go back to the beginning. It was back in the 1890s that atmospheric carbon dioxide was thought to alter surface temperature through the greenhouse effect. And in 1893, Munch saw the setting sun turn the clouds a blood red and sensed an infinite scream passing through nature. And his famous picture, The Scream, was originally called The Scream of Nature. And that scream is getting louder and louder and louder. So, why didn't I do more? Well, at the beginning, obviously, nobody really knew that it was happening, even though we'd known since the 1890s it was a risk. And in 1962, this was the first big environmental book about poisoning the planet, documenting the adverse environmental effects caused by pesticides. And this was required reading when I was at school when I was 16. But I really didn't think that was really relevant to me. Back in the 1960s, that's when most of the green and environmental movement starts, like Greenpeace, World Wildlife Fund, and Friends of the Earth. And importantly, this is when we first had this picture of the Earth from the moon, and that showed Earth to be a small, finite planet rather than a source of infinite resources. When I was in medical school, after my second year, I went on a working holiday around the United States. And when I went, the bin on the left was the sort of bins that we had for garbage refuse that we had in my family home. When I was a child, we had two of them. One was full of ashes from burning coal, and the other had a small amount of the debris of household living. And it was only in San Francisco in 1972 that I saw my first recycling bin when I was visiting friends. And in that bin was newspaper, another paper, cans and bottles. There was no plastic. And the media were becoming aware of this. In 1981, even there was a TV program warning about global warming. I didn't see that particular program. But I think nobody was really talking about scary things back then. In 1992, that was when we had the first Earth Summit in Rio, and again, people didn't really like feeling guilty about climate change, but probably didn't know what to do. In 1996, my children's school had a recycling project, and so my children were coming home talking about recycling, which we weren't doing at home at the time. I think the message there, if you want somebody to change, a sort of middle-aged man to change, then the best way to get them to change is get their children to tell them to change. So at that time, it didn't really seem that people cared too much about this problem. In 2008, the UK brought out a Climate Change Act and an oversight committee which compelled the government to take action. And by 2012, when I was age 60, I was feeling I really should be doing something, but I didn't know what to do about it in my practice. And about the same time, Bristol was appointed Green Capital of Europe when we were in the European Community. And as a result of that, a number of us came together and brought different solutions to different parts of a puzzle about what to do. So we started to answer the question, what can we do in our practices? And we came up with over 100 actions that say what we should be doing, why we should be doing, and how to do it. And we used an existing platform which had been set up a few years earlier by UK's National Union of Students. In 2020, the UK was the first National Health Service to set zero net targets, and the targets are to become net zero by 2040 and net zero plus by 2045. So that plus involves all the things that are bought into the health service. In 2023, last year, at the Conference of the Parties, which is the United Nations annual conference on this issue, what the world's governments and other organisations finally agreed is that something needs to be done. And now we just need to agree the what, the how, and the by when. But even though countries like the UK have got a Climate Change Act and Oversight Committee, it's moving more slowly than most of us would like. And even last year, our High Court said that government must actually get on track to deliver climate change and be compliant with the Climate Change Act. And on the 31st of March, the government brought out these sorts of solutions to what is going to be done. And the general judgment is that the government is not acting fast enough and is doing too little too late. So why don't we do more? Well, there are other reasons as well. So Gus Beth, who's about my age, is an environmental lawyer in the US. And he used to think that the top global environmental problems were biodiversity loss, ecosystem collapse, and climate change, and that 30 years of good science could address these problems. Now he believes that the top problems are selfishness, greed, and apathy, and we need spiritual and cultural transformation to do that, but we just don't know how to do it. So in the face of that, we need relentless, stubborn optimism, and those are the words of Christiana Figueres, who was the co-chair at the 2015 Paris Climate Talks. And what we don't need is environmental grief, climate depression, eco-anxiety, futilitarianism, or just being a doomer. So I hope that sort of makes us all stop and think about what we need to do. So what is to be done? Well, I'm going to use a parallel from the early 20th century when a leader of a social democratic movement was getting frustrated because his movement was stalled. Nothing was happening fast enough, and it seemed to be in limbo. So that leader of a social democratic movement was Lenin, and they'd had a period in the rise and consolidation of the theory and program of social democracy, as it was called at the time. And then the second period was a scene of social movement with an upsurge of the masses of the people as a political party. And these both are similar to what's been happening in climate change. The science has been there. There's been a movement recently with Extinction Rebellion, Greta Thunberg and others. But now we're in this third phase, a third period where we've got disunity, dissolution and vacillation. And as our government recently demonstrated, when it was urged to say how it was going to achieve net zero, instead of focusing on net zero, it started talking about energy security and backing away from the net zero challenge. So Lenin's answer, when in his pamphlet about what is to be done, he had a very brief reply: put an end to this third period of disunity, dissolution and vacillation. And that's what we all need to do now regarding climate change. Because we need many more doing everything possible rather than just the few doing every impossible thing. In family medicine, how do we improve, protect planetary health? What can we all do about it? What do we need? Well, we need understanding. We need to understand that low carbon is the only direction of travel. It's better for our patients, it's better for our populations, it's better for our practices. And we need knowledge. How do I do it? And how do we do it? What we're trying to do is avoid the unmanageable. So we need to reduce as much as possible our global greenhouse gas emissions. And we also manage the unavoidable because climate change is coming. So we have to adapt to what is coming. And only last month, the monthly mean CO2 concentrations went over 420 parts per million. So the carbon emissions are still rising in our atmosphere. If we look at primary care, family practice, then this is what we see when we look at it in the UK. We know that 60% of our carbon footprint, carbon emissions come from our clinical work. 13% of that is just from the propellants in metered dose inhalers, and the other 40% is what we have from just running an office. If we look at our non-carbon clinical footprint, then we can see that electricity and gas and patient travel and staff travel are major components in that carbon footprint. And if we look at electricity in our carbon footprint, we know that things perhaps unexpectedly like fridges cause huge amounts more of our carbon footprint than we probably thought. We also need to manage the unavoidable. That's adapting for the climate change. And in the UK, we know we're going to get more frequent and worse flooding. We know we're going to get our extremes of temperature. We're thinking we'll probably get shortages, risk to our natural capital, risk to our food production, and the new and emerging pests and diseases that come from changes in our climate. But for every complex problem, there is an answer that is clear, simple, and wrong. We have to find the answers that are clear, simple, and not wrong. What can family physicians and staff do? Well, there's obviously the individual actions we can take at home. There's our work-based actions. Some of us can educate others. Some of us may have an influence on the media, influence on research, and even influence on governments. With individual actions, the simplest thing you can do is check your own carbon footprint. If you've not done that, then it's the first thing that you should do. And it's very easy to do. There are simple websites which give you that information, and it takes around about 5 to 10 minutes to actually roughly work out your own carbon footprint. We have got on our UK Health Alliance for Climate Change a carbon literacy guide, and that will be a good starting point to learn more about it. The first point in carbon literacy is what's the volume of 1 tonne of carbon dioxide? Well, it's roughly the same volume as the volume of a normal-sized hot air balloon. And 1 tonne is roughly the same weight as an adult female giraffe. Your work-based actions, what can you do? Well, you need to decide what you can do in your practice. Use a free Green Impact for Health toolkit. You can add sustainability to the agenda of your meetings, because if you don't talk about it, you won't do anything. But if you have it on your agendas, you will talk about it and you will do something. And remember, because 60% of the family practice carbon footprint is from medical treatments, you need to involve your patients. So if you share the decision making and get your patients informed consent, you're likely to reduce over investigation, reduce over diagnosis, and reduce over treatments. And you should always be asking, is it good for the patient and good for the planet? Our toolkit in the UK, which we started in 2014, was based on this National Union of Students website, and by the end of 2022 we had 1,500 practices with 2,000 users, and that's around about 15% of all the UK practices. We've moved over to a new National Union Students website which has much greater functionality in 2023, and I'll show you that in a moment. So in deciding what you can do in your practice, toolkits are helpful, like ours, because it's free, it's easy to use, it's designed by GPs for GPs, it improves your sustainability, it saves money, and it's had a good recent independent review. Our original website looked like this, and I'm showing this because the coloured tabs are a good way to show the actions that we actually talk about taking. So we're talking about taking actions regarding our water use, our prescribing, our travel and exercise, our quality improvement, our zero carbon, our news and communication, our food and drinks, our vulnerable groups, our energy saving, our healthy planet, our waste and recycling, our learning, and our social prescribing. Our new website looks like this. It's very easy to use. There's a video on the home page which will tell you how to use it, and it's very simple to register. I won't go into too much detail about how to use this, but if you want to know the contents, then there will be a way of sharing that with you later on. But this actual website is meant really just for UK practices. So individual users can join their teams, and then when you've joined a team, you've got your own individual dashboard homepage, which tells you jobs which you have rated as a priority and jobs which have been assigned to you. When you go into the actual toolkit, there are ways of filtering it to find the actual actions that you want to take, and they tell you what to do, why to do it, and how to do it. And again, as I say, there's lots of these different filters, so you can get down to exactly what you want to do in the team. And there are different levels: bronze, silver, gold, platinum, diamond, with degrees of difficulty. If we look at this one on prescribing, there's the criteria. It tells you what you should be doing. It then gives you further information on why do it and how to do it. Then we have students who go in and audit the actions, because you can apply for awards and prizes with this. And then this is a section where you add either your own text or download files to demonstrate that you've done it. But even if you don't actually want to participate in the toolkit, there's another way of doing it, which is to download all the criteria through a spreadsheet. And that looks like this. You can see all the action criteria and all the further information. And if you want, we can share this sort of information with you so that you can sort of see the things which are appropriate to your practice here in Turkey, and perhaps adapt it for your own toolkit. In our toolkit, we have other things there, other helps, like frequently asked questions and past newsletters which have current information. So what else is our Royal College of GPs doing in the UK? Well, in the new strategy from our college for 2023 to 26, included responding to the climate emergency as a priority. The college had already declared a climate emergency, but it wasn't deemed, for some reason, a priority. Now it is a priority. So since 2022, all of our 32 local areas have a lead GP for climate change, and there's a national leads group. Since January 2023, we have learning modules on climate change and planetary health, a practice decarbonisation guide, and links to other net zero aids. In February 23, the Green Impact for Health Toolkit moved to this new improved website, and just 10-11 days ago we rolled out a new primary care development advisor service which will help practices train in carbon literacy, carbon footprinting, and individual practice decarbonisation. That's across England in the UK. We also have other organisations in primary care family practice, such as Greener Practice, which developed from a group of enthusiasts, and now we have networks across the country. And the idea there is that you can find support from these networks and access to resources which will help you become greener. We also have other organisations like the Centre for Sustainable Healthcare, which is a charity which was set up about 14 years ago, and that's one of the sort of national sites for training in green issues. So, summary and next steps. We are all in this great transition from our old life of profligacy, profiteering and politics poisoning the planet to a new and hopefully better life protecting planetary health. And you can be part of the solution, not just the problem. Because we want, as with all businesses, family practice to have a triple bottom line, where we report both the social, environmental and economic impacts of outcomes of what we do. So, how can you do more and spend more time with the patient when you have increasing workload, an ageing population with multimorbidities, underinvestment in healthcare, overloads of information and regulation, constant technological developments, reorganisations and changes that undermine your delivery of care, and of course the aftermath of the COVID pandemic? You just need to take a first step with just one patient a week. So I'm suggesting that your next patient, your first patient on next Monday, or the day which you find is your easiest day, start trying to do things which are good for the patient and good for the planet with that one patient. And then with experience, build on that and extend that culture, that mindset to the rest of your work. Then the second thing you need to do is really add sustainability to the agenda of your meetings. It makes a difference. If it's on the agenda, people will talk about it. If it's not on the agenda, nobody talks about it. Really, the most difficult thing is persuading people that it is possible. But if it's a big hoax and we've created a better world for nothing, we've still done good. Thank you. So if everything's working to plan, we should have time now for live questions and answers. Thank you again.
Thank you, Dr. Terry. It was a nice presentation.
Thank
and
you.
very practical one. It's a good idea. Okay. If there is questions or contributions, I would like to ask for audience, and maybe I want to ask something. Dr. Terry, I want to ask you, what do you think about artificial intelligence? Could it be the one which would shape the fourth period in our life? As far as computers are the most important factor in carbon footprint, as you mentioned, and nowadays it's a very hot topic. We are discussing on that the AI will shape everything in next future. What do you think?
Undoubtedly, artificial intelligence will affect all of us in all our lives. But the problem is that if we're going to mitigate the changes and adapt to the changes, we have to do that before artificial intelligence can probably help us. So it's unlikely to be the solution, and we all have to act now. A big danger is always thinking that somebody else or something else is going to solve this problem for us. But in reality, this transformation that we have to have means we all have to change. You know, in everything we're going to have to decarbonize, more electric. We have to different ways of working, and that's all going to happen. And we have to start doing it now rather than later.
Yeah, thank you. Maybe it would be a good solution for the change.
Well, we don't know. I mean, for instance, cloud computing, these huge cloud computing centers, you know, have a huge carbon footprint in themselves. So it's a bit like all these great things that have helped us in society. They all have a cost, and we have to be, you know, keep our eyes open to what that cost might be. But who knows? You need to be able to foresee into the future, which of course none of us can really do.
Okay, thank you. Any other questions or contributions? I think we done a very well job. It was very, very important topic, and so many different and interesting speech. Thank you all for the speech, and I like to give the term to Dr. Özden. Maybe she would like to say something.
Thank you very much. It was a really privilege for me to be with you here. I just said and wrote before, but maybe Terry or Andre, and I'm not sure if Christian here. Yes, he is. Do you give any feedback to us or anything you would like to add?
Well, I'm happy to share anything that we've got from our toolkit, you know, the content, so that you know, if you want to have a look at it to see how that might be applicable in Turkey or elsewhere, you know, you can use this as a starting point just for ideas, because it's quite difficult if you're starting, you know, with a blank sheet of paper. It's much easier sometimes if you can beg, steal, or borrow somebody from something else. So I'm happy to share any of our contents with you to help colleagues in Turkey get going.
That would be wonderful. While you were speaking, I just think about why could not it be a project for an assistant, research assistant, and that would be a good starting point. Thank you.
Okay.
I'd like to say thank you to Özden for bringing this excellent meeting together and communicating with people all over the globe and different continents. And it's wonderful that we come together for this. Really, really humbled to be among so many wonderful people doing excellent work. It's lovely to be here.
Thank you.
Yeah, also want to really to thank the organizers for this wonderful event. It was quite good, and at the same time, raising this topic to the attention of the family physicians. This is quite, it's really very important, and if they have to know how much they can do to really contribute to solving the problem, mostly caring of the patient and then caring of the community as family physicians, that can be really can have a huge impact. And really thank you for this job.
And so, thank you very much. We have finished the first marathon. I do hope we could just be successful for the second one. And thank you very much again.
Okay.
Yeah, thank
Thank you.
See you.
Okay.
Thank you.